Hello everyone, this is Dr. Meenakshi Gupta. Today I am going to discuss one of the important contraindication of the ACE inhibitor or the PRIL drug. So under the ACE inhibitor comes the very important drugs. They are captopril, lisinopril, enalapril, ramipril. So all these drugs, they are contraindicated if the person is having bilateral renal artery stenosis. Now what is the cause? To understand that, first you must know how the pressure gradient that is developed in the glomeruli. Okay. So this is the glomerulus, and here it is a afferent arteriole, and this is a efferent arteriole. Now how this GFR that is maintained? This is because of the pressure gradient between these two arterioles. So pressure gradient here, it is around 110 mm of Hg, and here it is around 10 mm of Hg. Okay. So this afferent arteriole, from where it comes? It comes from the this is the heart. From the heart, here is the aorta. From the aorta, here is the renal artery, and one of the branch of the renal artery. So this is a aorta, this is a renal artery, and this is the afferent arteriole. Okay. So this is how the kidney, it gets the blood supply from the aorta, and this from the efferent, it is further going to form the peritubular vessels, all the veins. This is going to form the peritubular blood vessels, and ultimately where it will go? It will go to the vena cava. Now because of this pressure buildup, this side and this side, what will happen? The filtration, this takes place. So what is the normal GFR? It is 120 ml per minute. Now what happens if there is a bilateral renal artery stenosis? This renal perfusion pressure, okay, what will happen in bilateral renal artery stenosis? This renal perfusion pressure does not develop, or it is decreased. Now if this is decreased, then what will happen? There will be decreased GFR, decreased renal perfusion. Then what will happen? Because of this, the renal perfusion that is decreased, the one of the important system of the body which is going to take care of that, which system gets activated? It is RAAS. This system, it gets activated. Now with the activation of the RAAS, you can see here, this I have taken in detail. So link will be given in the description box. If you haven't watched that video, you can go and watch that. So what is the renin, angiotensin, aldosterone system? How does it work? So it is all the three, this renin, angiotensin 2 and aldosterone. What they do, this renin, it is going to convert this globulin into angiotensin 1, And then this angiotensin converting enzyme, they are going to convert angiotensin 1 into angiotensin 2. And this angiotensin, it is going to act on 81 receptor at different site, and the most important action is on the blood vessels, okay, then on the adrenal cortex, on the adrenal medulla. What they are going to do by acting at here, they are going to cause the vasoconstriction. So this is the one, this angiotensin 2 here, what does role it plays? So angiotensin 2, they are going to maintain the perfusion pressure of the efferent arteriole. You can see in the next figure. So if there is a bilateral renal artery stenosis, then what will happen? Because of this bilateral renal artery stenosis, this is going to decrease the efferent arteriolar pressure and GFR will be decreased. Now what happens with this decreased GFR? It is going to cause the activation of this RAAS system, and this will be formed, angiotensin 2. Now what is the role of this angiotensin 2? They are going to cause the constriction of the efferent arteriole. So this pressure of efferent arteriole, that is maintained by this angiotensin 2, which comes from the RAAS system. Then what will happen? The efferent arteriolar pressure will be increased, and this is going to maintain the GFR. Suppose if we give ACE inhibitor, then what will happen? If you are going to give the ACE inhibitor, where they are going to act? They are going to inhibit this conversion of angiotensin 1 to angiotensin 2. So angiotensin 2 won't be formed. Now if there is, so ACE inhibitor, what they are going to do? So they are going to inhibit the conversion of angiotensin 1 to angiotensin 2. They are going to inhibit this. Then what will happen? The efferent arteriolar pressure won't be maintained. And then what will happen? The person may go for anuria or can go for acute renal failure. That's why the ACE inhibitor drug, they are contraindicated if the person is having bilateral renal artery stenosis.